Vesicovaginal fistula may present day to weeks after the initial inciting surgery, and those following the hysterectomy typically present at 1 to 3 weeks. Most common genital fistula in India. It classically presents with unexplained continuous urinary leakage from the vagina after the recent operation. Other less specific symptoms of the genitourinary fistula include the fever, pain, ileus, and the bladder irritability. Vesicovaginal fistula is a subtype of the female urogenital fistula. VVF is an abnormal fistulous tract extending between the bladder and the vagina that allows the continuous involuntary discharge of the urine into the vaginal vault. Obstructed labor. Common rupture of the uterus, caesarean section. Keel and forceps can injure the bladder during the rotational delivery. Abdominal hysterectomy for the PID, endometriosis, and the cervical fibroid. Radiotherapy causes a bladder fistula few months to 2 years due to the ischemic vascular necrosis. TB, cancer of the lower genital tract, and rarely a bladder stone and perforated lucid. Symptoms. Dripping of the urine occurs after the varying interval following the delivery 5 to 7 days. Vesicovaginal fistula by the obstructed labor manifests after the first week of delivery. Unexplained continuous urinary leakage from the vagina. Other less specific symptoms of the genitourinary fistula include fever, pain, ileus, and the bladder irritability. Diagnosis. Triple swab test is the investigation of choice to establish the diagnosis of the suspected vesicovaginal fistula. It confirms the presence of the vesicovaginal fistula and also differentiates it from the uterovaginal and the urethrovaginal fistula. The most valuable investigation in an established case of the vesicovaginal fistula should be cystoscopy. Foley's catheter is the most appropriate method for collecting the urine for culture. Treatment. A conservative method, waiting for the spontaneous rupture by the prolonged catheter, is useful in the small fistulas. Surgical method, in most cases, by the vaginal or the abnormal approach. Vesicovaginal fistula, repair the surgery. The drainage should be done for 14 days. The most appropriate method for collecting the urine for culture in case of vesicovaginal fistula is Foley's catheter. Vesicovaginal fistula repair surgery. The drainage should be done for 14 days. Vesicovaginal fistula by obstructed labor manifests after the first week of delivery. A 52-year-old lady presents with a constant leakage of urine and dysuria 2 weeks after the complicated total abdominal hysterectomy. Diagnosis of the vesicovaginal fistula is suspected. The most important test for the diagnosis is a triple swab test. A 52-year-old lady with a vesicovaginal fistula after the abdominal hysterectomy is not responding to the conservative management. Most useful and the important next investigation is cystoscopy. Obstructed labor is the most common cause of the vesicovaginal fistula in India. Vesicovaginal fistula is the most common genital fistula in India.